So just to capture your attention, this is a picture of jet injectors from the 1960s when they were first invented. They were originally used for mass vaccinations and inoculation, worked very well for the polio vaccine. But there were some issues with it. And now new jet injectors are far beyond what we could have imagined. You can control depth of penetration, and there's no fear of contamination as well. And they provide a needleless method to penetrate the epidermis and dermis of the skin. So we wanted to know, because there's been so much more use of jet injectors in dermatology, including for skin aging and polymer hyperhidrosis, we wanted to know if we could also use it for photodynamic therapy for basal cell carcinoma. So we know for superficial basal cell carcinoma, clearance rates are around 75 to 95% for PDT. However, for our deeper nodular basal cells, clearance rates are closer to 50%. So our question was, can we apply photosensitizer differently, potentially with jet injection, to access the deeper dermis? So not just using topical application, but using our jet injector. So a few members of our team showed that jet injection actively penetrates the epidermis. They jet injected porcine skin, you can see in the image on the left, with ink, and you can see that it actively penetrates the dermis, and this allowed us to figure out which pressure settings to use for our new jet injector that we used in clinic. Okay, so for methods, we had 15 patients with 17 basal cells. So for 4 of the patients, we did jet injection of photosensitizer, followed by surgical excision of 4 of those basal cells, so that we could examine them histologically after to see penetration of this photosensitizer. And then in the other 11 patients with 13 basal cells, we jet injected them with photosensitizer, followed by photodynamic therapy, and we repeated that treatment twice with an interval of 4 to 6 weeks. So we wanted to look at tolerability and feasibility of the method. So we looked at local skin reactions like erythema, edema, flaking, scaling, and crusting. We also wanted to see pain levels. So would this be less painful than potentially a needle injection of the photosensitizer, if that's the goal of getting deeper? And we also looked at cosmesis and tumor clearance, as well as patient satisfaction. So just to show you the results and some pictures. So treatment 1, before and after. So on the left is our basal cell carcinoma. It's the lower left side of the patient's backside. And you can see right after treatment of photosensitizer with jet injection of photosensitizer, you can see the erythema of the area. And that we found in pretty much all the patients. Erythema and a little bit of edema was our main reaction, but there was no further kind of adverse event that occurred. Pain during this process was around a 5.6 out of 10 on average for all patients during the injection itself, and then 3.7 during the 3 hours of illumination. We performed it again 4 to 6 weeks later. You can see the patient and most patients cleared up altogether in that 4-week interval. And then again, you can see the erythema after jet injection of the photosensitizer. And then we did a 3-month follow-up visit to check for persistence of the tumor as well as cosmetic effects. And you can see there is a small scar left behind by this method. Not sure if you're able to point to it, but you may not. No, I'm not. But there was a small scar left behind. So what we found was that there was smoother skin texture after this method, some hypo and hyperpigmentation, and 70% were left with some local scarring. And you can see the pictures of that here on the right. One patient was covered with basal cell carcinomas, and those were surgical excision scars, but then our method was a smaller white scar left behind. So ultimately, we had 11 patients with 13 tumors. 2 tumors did persist, and we found that 1 patient had got cellulitis after the 2nd treatment. It was interesting of note that that patient also had 2 tumors treated on the same lower leg. So altogether, we had a 91.7% clearance rate and an 8.3% recurrence/persistence rate with this pilot study. Yeah, so in conclusion, this is a potentially feasible method for a certain group of patients. Although there might be some scarring, it could be appropriate as a new method. And this was the team I worked with. Thank you.